Okay, good morning. Welcome to this morning's seminar for the retail sector on COVID-19. This is part of a wide suite of actions that are being undertaken by partners across the city to try and help drive down the rate of transmission. Recognise that this week is an extremely busy week for the retail sector, so we intend to keep this session as brief as we can and will last no longer than 45 minutes. If I introduce the speakers first, there are three speakers this morning. We've got Dr. Paul Southworth, who's a consultant in public health medicine at NHS Grampian, who will provide some background and some information on what the data is telling us. We then have Del Henderson, who's a principal trading standards officer, who will provide some information on the restrictions that apply and the rules that apply to the retail sector, as well as some of the lessons that we're learning from the visits that are being undertaken at present. And then to finish up, we've got Chief Inspector David Howison, who's going to talk about personal responsibility. Due to timings, we're not going to have time for a Q&A session as part of this, but if you can please submit your questions via the function at the side of the screen, we will produce a frequently asked questions document at the end, which will be published on the website, as will a recording of this seminar. Okay, if I can start by then passing on to Dr. Paul Southworth.
Thanks very much, Andy. Good morning, everybody. So I'm just going to go through a couple of slides of data and then what we do in public health in terms of the kind of interventions that take place to try and control the pandemic. Can you move on to the first slide, Laurie? Thank you. So this is the picture of positive tests for COVID in Aberdeen City over the course of the pandemic. Obviously, to the left, you see what was known as the first wave, and the scale of that is very misleading, given that at that time testing was not as widely available as it is now. What I really want to draw your attention to is the trend from September really on to now. You see a big bump at the end of September, beginning of October, and that really coincided with the students returning to Aberdeen, but it was actually a surprisingly contained cluster of cases and didn't seem to greatly affect the broader pattern. But what we actually see, that kind of masks what was happening from about September to now, which is a slow but steady increase in cases. And what you can see at the very right-hand side of that graph is for the last couple of weeks, this really accelerated rise in cases, which is a great cause for concern. I should just say the last couple of days will be incomplete data, and so that little drop at the end should be ignored. Next slide, please. So in terms of the situation summary of this week, so we produce one of these every week. So this is for Tuesday based on data up to Monday. But for that week, we've seen rapidly rising cases in Aberdeen City, about a doubling of cases that week, and therefore a doubling of the rate per 100,000, up to about 130 cases per 100,000 for the 7 days. And just as a reminder, it wasn't that long ago we were saying that we need to restrict travel from countries where there were 20 per 100,000. So although this may not look as bad compared to some other parts of the UK, it's a very concerning situation, and the direction is really important as well. If things stay the same, we would expect the direction to stay the same as well. It's also reflected in the rising percentage positives of cases. So this isn't just about people getting tested more. The proportion of people getting tested coming up positive is also increasing. EDR is a dissemination ratio. Basically, this is a kind of local estimate that approximates to the R value that you'll have seen discussed in the media. It's not exactly the same thing, but it's similar. And because that's at 1.5, basically anything above 1, we'd expect this exponential increase, meaning it increases more and more each week. So again, very concerning situation. And we see about a third of cases that we find are not linked to known clusters, events, situations. And what that means is they're very difficult for us to prevent. Test and protect can prevent onward transmission only for those cases we know about. So this suggests that in about a third of cases, they're infected by cases we don't know about, which again is very concerning and is part of the reason that the government makes the decisions on the levels is how much we're able to do with the interventions we have at hand locally. So you may have seen in the press that recently food processing had been part of the picture of cases in Aberdeen City, but that's not been a feature this week. We are seeing more cases come associated with shopping, with gym classes, and with hospitality sector. Next slide. So this is my budget version of a diagram you've probably seen many times, basically showing that the way the infection spreads is through social contact, and if nothing is done, if we act the way we always did, it tends to infect, we think, about 2 to 3 people each. So all the interventions that take place are trying to reduce that social contact so that on average people infect less than 1 person and the epidemic doesn't grow out of control. Next slide. So in terms of the first thing, and I think it's one of the things that will get discussed in all the presentations today, is about this individual responsibility. These measures are really aimed at forming a bubble around a person so that both they're not able to infect others if they're a case, but also they're not likely to get infected themselves in the first place. And so it's trying to block all those transmission routes, and it's the facts that you've been hearing about everywhere. The wearing face coverings when you're within 2 meters of others and when you're in certain settings, avoiding crowded places. It's really important. The more people there are in a place, especially indoors, the more the chance that COVID will be spreading in the air. Cleaning hands regularly. I know you've heard all this many times, but I think it always bears repeating. If you touch a surface that has COVID on it and then touch your face, as we naturally do, you may transmit the virus to yourself. If people are coughing, if they're breathing, the virus can fall on surfaces. And obviously, if people touch their hands to their mouth and they're infected and then touch a surface, it can spread via surfaces. And it's really important to remember that it's both aerosol through the air that the virus can spread, but also on surfaces. And the 2 meter distance, there's been a lot of discussion about what the distance should be. And there is no zero risk distance and there is no definite infection distance. But the further away you are from somebody, the less likely you are to get infected. And at 2 meters, the risk is dramatically lowered. And the last one is this self-isolating and booking a test if you have symptoms. It's incredibly important. We still see cases of people who get some mild symptoms, and we're talking here about the cough, the fever, and the change in or loss of taste or smell. They get these symptoms mildly and think, oh, it's probably something else. Continue to work, continue to go out into premises, and then by the time they do book a test, they've already spread it onto a number of people. So it's really important that these individual actions, both for consumers and for staff, are really the most important part of this whole system. Next slide. And we have test and protect, and test and protect tries to we try to find as many cases as we can and then take them out of circulation so they can't infect other people. So you're not doing anything about stopping that person getting infected, it's too late. Although we do try in the test and protect process to ascertain where people have been for the week beforehand, so we can get an idea of where people might have caught it, so that we can see if there's a number of people who might have caught it in one place. But this is really about stopping onward transmission. And so in this case, you get the first figure is taken out of isolation, and also their contacts who may already be infected. Next slide. So there's 4 really important aspects of this, and I think it's really important that we recognise we're part of a community, and we need to follow these ourselves as individuals, but also try and support others to do it. And sometimes that's as an employer, sometimes it's as a friend or a neighbour. But in the first case, it's anybody who gets any of these symptoms should isolate and get tested. That's really important. If we don't know where the cases are, we can't do anything about it. Then there's the tracing process. So in this case, when a positive test comes through, it'll come to our contact tracers who will ring the individual and go through quite a complex conversation about when their symptoms started, where they've been, who they've been in contact with. And then in Grampian, we also phone the contacts as well and have that conversation with them about how likely they are to be a contact. In many cases, it's obvious. If you live with somebody who's a case, you will be a contact. But in some cases, it's a bit more complex. I'm not sure quite how far we were apart, how long we were together, in what circumstances. And so we'll have that discussion with the case and the contact to be quite defining about it. Then there's the isolation. If somebody is infected, or they might be infected as a close contact of a case, it's really important that they properly isolate for the 10 days. That means staying at home. It means not going out for any reason unless it's an emergency, unless it's for really urgent medical need or something like that. And again, we can have those discussions here about what you need. And that brings on to the fourth point, which is support. And again, there's support available from us in terms of, well, we'll pass details onto the local authority if given consent. And the local authority have a number of things in place in terms of potential financial support also for the basics of life, getting shopping, walking your dog, getting medicines. If you need to go and care for somebody, you know, there's a lot of support that's available, and it's really important you ask. I should say Test and Protect, when you speak to contact tracers, is completely anonymous. If you want it to be, the more we're allowed to share with the local authority or with an employer, the better, because then we can have those discussions about trying to work out any issues that we can resolve in terms of how somebody got infected in the first place. But it's completely anonymous unless we're specifically told that somebody wants to share that information with, say, their employer. And I think it's really important in that context to encourage everybody to be as open and honest with contact tracers. They're not there to catch anybody out for breaking rules or making mistakes. We're only human. We're there to find out what happened and reduce the risk. Next slide. So it's not a terribly interesting slide, but this is another really key thing that we do locally. When there's an incident which goes beyond just one or two cases, that may or may not have caught it from each other in a premise. If it's a more complex situation, then we put together a problem assessment group or an incident management team, which are very similar meetings where we would come together with ourselves, environmental health, depending on the setting. It might be the manager, it might be a head teacher in a school, it might be health and safety executive, depending on what the setting is. But we all get together to discuss the situation and try and work out if there's any ongoing risk, to reduce that risk and to resolve the situation. Next slide. And the final thing is the national measures. So when local measures are not seen as being sufficient to halt the spread of the pandemic, then national measures are taken. And this is where the tier system comes in, or the level system, which we've obviously seen come into place in Aberdeen this week, or coming into place this week. And this is really an effort to put a bubble around everybody to try and reduce social contact across the board. We know the full lockdown had an impact, and we've seen in Aberdeen ourselves in the sort of August time, when we had our own mini outbreak, that we had those very stringent measures in for a short period of time, but the cases then did go down to a very low level for an extended period. But obviously, it's important to say that we as public health have some say in advising on that and giving the figures and saying what we think, but ultimately that is a political decision nationally. But together, that's all the measures across the piece that we have to do. But it's test and protect and personal responsibility is the really important bit. And if that fails, then it comes to these national population-wide restrictions. Next slide. So you may have seen this already, but I just wanted to point it out again for anybody who hasn't. This is basically giving all the information you already know about, but it's in a handy form, and we have it in a number of languages. It's available on the NHS Grampian social media, or get in touch after this if you can't find it, and we're happy to share it. And it's really about telling people how they can shop more safely. You know, the wearing the face covering, keeping distance. If it's possible, shop by yourself. Obviously, it's not for everybody. Using the hand sanitizer and the cleaning sprays you all provide, contactless payment when possible, and trying to shop at quieter times, trying to spread out the shopping so that everybody's not there at one time, because like I said before, the more people there are in one place, the more chance that the infection can spread. So it's the basics you already know about, but hopefully in this handy list, and I'm happy to share it to anybody who wants it. And that's me. Oh, sorry. Sorry. Now I'll pass on to Del Henderson from Protective Services.
Hi, I'm Del Henderson. I work with Trading Standards and Environmental Health. We have been involved in the enforcement of the regulations since lockdown. We share the enforcement responsibility with Police Scotland, but we are the ones that mainly deal with businesses. We've been out giving advice and we deal with complaints. Next slide, please. This is a list of the topics I'm going to cover. I know it seems quite a lot for this short space of time, so some of them I will skim over. I'm basically going to do a brief overview of the legislation itself, also mention the guidance, speak about risk assessments, and maybe more importantly, give some practical pointers. It's things that we've found recently when we've been out and about doing visits. Next slide, please. We're currently in level 2 in Aberdeen, but we're moving to level 3 tomorrow. There are 5 levels in total, 0 to 4. From a retail point of view, the requirements that I'm going to talk about today, in essence, remain the same all throughout the levels. It's the same requirements really that have been in place since we started. We did start with 2 meters, we've moved to 1 meter, and we're back to 2 meters. And we've also got face coverings now. In the last couple of weeks, we have been out and about doing some visits to larger retailers, the ones that might be busier and have more queues at Christmas. So we've been out assessing compliance and giving advice. For that, we used a questionnaire, an aide-memoire. We're going to make that available on our website after this. That might help businesses have an idea of what you should be looking at within your own business and help you comply. Next slide, please. There's only 2 slides on this, I promise. This is the regulations. This is the legislation as to which all businesses must comply with. We all know this, but really this is about keeping the business there's an onus on the business to ensure that there's enough room so that 2 meters can be maintained between all people on the premises. And you then have to control the numbers coming into the store so you don't have too many people in. And if you have a queue outside, that there's 2 meters between those people in the queue. Next slide, please. And this second bit, this is the other measures you take. This is the stuff that requires you to maybe change your layout, to control numbers in the toilets, to install screens, to put signs in, to have an enhanced cleaning regime, to increase your ventilation. Basically, these are the other measures that you need to put in place to try and prevent the spread of coronavirus. Next slide. And this is a brief mention. The Scottish Government have provided guidance for the retail sector. It's available on the Scottish Government website. I've got a link at the end of these slides. It covers the workplace safety, and it actually has a very good checklist that's available within that, and that helps different sized businesses make their premises safe. Next slide. I've got 3 slides on risk assessments. This is I probably will go do these quite quickly, so you all have risk assessments anyway. The whole point of a risk assessment is to decide what actions you have to take so that you then put the correct measures in place. Next slide, please. This is brief 5 steps as to how to carry it out. It's the same as any other risk assessment. What I will say here is involve your employees in this. You have to involve your employees when you're doing any risk assessment. It's the best way to make it to work. Employees know the business, they do the jobs on a regular basis, they can help you. If you've got less than 5 employees, you don't actually have to write your risk assessment down, but it's recommended that you do, because then if there is an issue, you can show an environmental health officer or a trading standards officer the measures that you have taken to comply. Next step. I say I'll just skim over this slide. This is just, you will know this is the you can put a risk assessment in place. You can't always not do an activity, so you might have to put measures in place. And this is, it's a risk-based thing here. You might have to use PPE in certain activities, but in general, it's for COVID-19, it's all about staying apart. It's using face coverings. It's enhanced cleaning. That's the main things you'll be doing here. Next slide, please. Numbers on premises. You've all been doing this since lockdown or since when you were allowed to open. Some businesses have never closed. And all businesses are doing this pretty well from what we can see when we're out and about. But it's just a reminder that you have to make enough space so people can stay 2 meters apart. You do have to limit numbers coming in. And depending on your business, how you do that will change. If you're a big place, you might have to have somebody on the door. You might have a traffic light system, or you might just have a simple sign on the door to say you can only have 2 people in at a time. What we will say is you have to be very flexible. This has got to be dynamic. If part of your store is looking busy, then you need to stop people coming in so you don't get it crowded. Next slide, please. Queues. The queue outside, the queue to enter your business is the responsibility of that business to manage. If you don't have sufficient space, some businesses have a lot of space, a lot don't. So you might have to mark an end point and ask people not to queue any further. If you're a big business, you might need a queue marshal. It does depend on the business, but the queue outside to get in is the responsibility of the business. Next slide, please. Face coverings. I will mention them here, but the actual requirement to wear face coverings is enforced by Police Scotland. But if we're out and about, we will give advice to businesses. For employees who cannot wear face coverings, then you need to work out their role. They need to be in a role that they can then remain 2 meters away from other people, or they're working behind the screen. You can't just have someone in their normal role if they're half a meter away from people all the time. Reminding staff how to wear face coverings, I think, is quite important. Face coverings being worn as chin warmers is really not a good look, and it's one that is what people complain about. People are more likely to complain about somebody not wearing a face covering correctly as opposed to someone who does not have a face covering on. So just remind your employees that they must wear face coverings and to wear them properly. Next slide, please. Customers. All customers 5 and over are required to wear a face covering, but there are people that are exempt for a number of reasons. There's no reason that they should not be coming into the business. But just a reminder, they might need to make sure they stay 2 meters apart, etc. But you do have to have an understanding that not everyone can wear a face covering. Those people that do wear face coverings, you can ask them to remove them to check their identity if you're selling alcohol, cigarettes, etc. Next slide, please. Trolleys and baskets. What I would say is, whatever cleaning materials you have in for trolleys and baskets or for hand sanitizer, make it easy so people can find it. You might get different customers in your store, they won't know where the stuff is. Keep it replenished, make sure it's replenished throughout the day. And I would also add, customers should not feel rushed using it. They should be able to clean their baskets, their trolleys. They should be able to use hand sanitizer without feeling they're holding up a queue or without people rushing past them. So maybe a reminder to people that can you just wait for this person to finish cleaning their trolley. Next slide, please. Layout. This will be different for different stores. You may want a one-way system that might work in the size of your store. You may want part of your store to be a one-way system. That is up to you. Need markings up. Signage and markings is what helps people comply. Everyone should know to remain 2 meters apart, but really we all need reminders. So that's where you have signs, markings on the floor, just reminders for people to give each other the space. And if you're using tannoy announcements, do that as well. Just gentle reminders. Next slide, please. Pinch points. This is one of the things we've if it looks like a problem, then there is a problem. So to remove any obstructions, remove any bottlenecks. I seem to have gone on mute there. I don't actually know why, because I wasn't touching anything. So say that's on the slide. Tills, that's the other point. You need to have sufficient tills open to make sure you minimize queues. And to impact on others moving about the store. Reinstate markings at tills. The shops all had them to begin with, but reinstate markings to remind customers to stay 2 meters back from each other. Also, at tills, there should be ample hand sanitizer for the staff to use, so that staff can sanitize their hands in between different customers, and especially when handling money. So it should be available for them. Next slide, please. Cleaning. Basically, the cleaning that you've always done, this is just an enhanced version of it. There's really no difference from cleaning now from what it was a year ago, apart from you need to do more of it. You need to concentrate on touch points. Think about your touch points. And this is not just in customer-facing areas. This is throughout your business premises. Basically, you need a frequent but effective cleaning schedule. So you need to make sure that whoever is tasked with doing something is doing it. They're using the right products and they're using the right equipment. Next slide, please. Customers. We've all got a role to play. I've got 2 slides here, one on customers and one on staff. And it's basically the same thing, is that we all know what the rules are, but it is easy to forget. We all forget. There's nobody does not forget to stay 2 meters apart. So customers do need to be reminded, and that's why we need to have the signs up. We continue to need the signs. We need to make sure the markings are there. It is good if shops communicate their expected behaviours, signs on the door, stuff on their website, etc. Because different shops have different requirements. So you need to pass that on to your customers. Staff is exactly the same. Staff should be staying 2 meters away from each other and from customers. That's not always possible. You need to interact with your colleagues. You may need to lift things. You may need to be close together. But if not, try and stay 2 meters apart. If you're having a meeting, make sure you're apart. And remind your staff to wear a face covering correctly. And wash hands regularly. That's the other important thing. Next slide. Increased ventilation. You've heard all about this all along. Is we need your air conditioning, increase the speeds, get the air changes, make sure it's coming as fresh air in, we're not recirculating air, have windows open, have doors open. Next slide, please. Behind the scenes, this is one of the things we've discovered when we've been out and about lately, that a lot of the businesses are very good at the front of house stuff, but sometimes behind the scenes is easy to maybe lapse a little bit or forget to do things. It's the same rules apply behind the scenes as apply on the shop floor. So there should be enough space for staff to be 2 meters apart. When you've got offices, when you've got changing areas, work out how many people can be safely in that space at a time, taking into account the space, the ventilation, etc. Put signs up on the doors, remove chairs from areas so there's not a temptation to go and sit down. Staff meetings, huddles, things like that. We do know of instances where a short staff meeting for a number of people took place in a small area. It was very quick, lasted 10 minutes, but the problem is one person had COVID. That is how to spread it around a group of people quite quickly. And then you have a number of people off self-isolating. That's the last thing any business needs at this time of year. So it's just gentle reminders to people. I say it's not people doing things deliberately wrong. It's just we all need reminders as to do things properly. Smoking areas is another thing. Smokers tend to huddle closer together. You can see that. So a reminder to your staff that smoke is to make sure they try and remain 2 meters apart. So maybe signs at areas that your staff smoke at. Next slide, please. Workforce planning, you'll be doing this already. Is dependent on the size of the business. You might have to stagger when people come in, when people leave, stagger your break times, staff training, instruction. As I say here, don't always presume that staff know the basics. Just keep doing it in regular refreshers. I keep reminding as to why we've got to do this. And also fitness to work, a regular reminder about that don't come in if you've got symptoms, etc. Next slide. Keep reminding your staff if you've got symptoms, however mild, get yourself tested, stay away from work, don't come in. And make sure people know how to do this. It's on the NHS Inform website. Again, I've got a link at the end. Getting a test these days is not difficult. So just encourage staff to do that. Next slide. Just a simple slide so it's easy to see. If someone's got a positive test result, you've got to self-isolate for 10 days as a minimum, whether you've got symptoms or not. If you're a close contact, you're also required to self-isolate for 10 days. Test and Protect will contact people who are identified as close contacts and give them that advice. And I've put a note down there. If a close contact gets tested and gets a negative result, you must continue to self-isolate for the 10 days as instructed by Test and Protect. Next slide. Staff training. You need to train your staff so they know what they need to do and why they need to do it. Use slides that Paul did at the start here. I think they will help communicate these things to your staff. Physical distancing, a workplace does look different and it will feel different. You need to have regular updates for your staff so that people don't get complacent. The whole idea of implementing the measures is that it's not just your customers that will have confidence, but it's your staff that will have confidence as well. Next slide. Here's an idea of some of the training subjects that we can do. You will be surprised at the number of people who don't know that they shouldn't attend work with symptoms. So do that. Do the 2 meters. Make sure people understand who's the cleaning regime, who's responsible for it, who's got to do it, make sure it's done, and advise your staff about face coverings. And also, if you've got any engagement with customers, different stores have got different processes here, but make sure your staff understand how they should be engaging with customers. Next slide. Compliance and enforcement. Along with Police Scotland, we've adopted the same approach, which is engage, explain, encourage, and enforce. Our aim is to give advice and guidance to ensure compliance. We're not coming in and taking enforcement action. That is the last resort. We want to help you as a business make your business safe for you to work in, for your customers to come into. If we give advice and a business ignores it or disregards it, then we do have these sanctions. We can issue what's called directions, which is basically requiring you to do something to prevent a public health issue. We can issue prohibition notices that could close a business down, or ultimately we can report to the Procurator Fiscal. Next slide. This is just a summary. I'll just skim over that and I'll go on to my final words. My next slide, please. As you know, COVID-19 is still a real risk. We know that. It's everyone's job to help control the virus. It's business owners, it's managers, it's staff, it's customers. We need to follow the law, we need to follow the guidance, and we need to not let standards slip. I then have a number of slides that I won't show you here, but run through them. The very last one should be a link on our website, on Aberdeen City Council's website. We do have a forum that if you require advice or you wish to make a complaint, then you can contact us. We will be putting these slides on the council website. We will also put on the aide-memoire or the questionnaire that our officers used when they're out and about. And we will also add any questions that get asked today. Thank you. I'm now going to pass over to Chief Inspector David Howison.
Thanks very much, Del and Paul, and thanks to everyone else on the call for allowing me this forum to speak. I think I'd like to start briefly by introducing myself. I'm David Howison, Local Area Commander for Aberdeen City South, which includes, amongst other areas, the city centre of Aberdeen. Thank you very much, I suppose is how I'd like to start. Thank you to retailers, thank you to all your staff for what you have done up until now in supporting the effort against coronavirus. We recognise how difficult an environment this has been for retailers, for your staff and for the general public. And on behalf of my officers and myself, I would like to extend that thank you for how you've supported us in our efforts. Across the town, there have always been strong relationships between local policing teams and retailers, and from my own observations, I think those have continued into the challenges set by coronavirus and lockdown and subsequent restrictions. As the police, we probably have two roles that I'd like to discuss in this forum. One is to support you in enforcing regulations and creating a safe environment for the public to come into your stores and for your staff to work within those stores, and also to support you in dealing with conventional criminality, if you like, where people react badly to your efforts to enforce the measures, and where my officers can support you with that. Individuals have a responsibility to support the community in fighting coronavirus, and the responsibility to keep people safe lies primarily with the individual. As retailers, you have a role in creating an environment which gives people the best chance at compliance, and Del has very eloquently run through the measures that you can put in place to do that. We will support you in your efforts by being highly visible to your staff, highly visible to the public, and also in proactively engaging with your staff and with the public to discuss the safety measures, to encourage compliance with things such as the wearing of face masks, social distancing within queues, and hopefully giving your staff the confidence that they need to proactively challenge people within the retail environment and encourage that compliance in the wider effort to keep people safe from the virus. We can and will use enforcement, but only as a last resort. And again, as Del has said, we've used a staged approach throughout the fight against coronavirus, and we found that to be extremely successful. And I think the public understand and appreciate the approach that we have taken. Enforcement doesn't extend to all areas of the regulations. We can, for instance, enforce the use of face masks where necessary. We can't enforce social distancing within queues to get into stores. That type of thing relies very much on communication, which again my officers will support you with. Where your staff are subjected to abuse or aggression because of their efforts to enforce regulations, we will robustly and quickly deal with that, and we are always available to deal with that, as we always have been, to support you in the retail community. Officers will be visible and approachable for your staff to contact on the ground should they need. However, if officers are not nearby, we can always be contacted via the 101 or 999 numbers. We will continue to support you throughout this. We recognise the significant sacrifices that have already been made by the wider public, by yourself as retailers and by your staff, and we just ask that everyone continues with those efforts, because they are vital in the community response to coronavirus, to driving down transmission rates, and really, to saving lives, to put it bluntly. Officers will be in greater number over the festive period, as they always are, because we recognise the additional demands that come with the festive period and on footfall within the city centre and the wider city, and we are there to support you. Again, I would just like to thank you very much for allowing me the forum to speak, and thank the other speakers and you as the retail community for all your efforts. Thanks very much.
Okay, well, thank you, Davey, and thank you to the other speakers too. It falls to me now to wrap up this session, and I think we are finishing on time. So thank you very much for your time today, and I trust you have found this session useful. I think the take-home message from today really is that we all have our part to play in helping to drive down transmission rates and get this virus back under control. So thank you very much. Stay safe and goodbye.